4 exercises for discogenic back pain with Dr. Noah Volz. Discogenic back pain is back pain that's caused by the disc. Oftentimes, this is called a lumbar disc herniation, and it can produce pain directly in the back, sometimes pain down the leg. And there's different grades of disc herniation. Some are less severe, some are more severe. And so they all have kind of different names for the severity of the disc herniation. So the 3 components of this type of low back pain is, like I mentioned, the disc gets damaged somehow and then can put pressure on the nerves or create pain signals in that area. The nerves locally there where the disc is damaged, but also the nerves that go down the leg can also be compromised here. And the muscles around the disc will often go into spasm, trying to protect that area. So those all 3 can lead to pain. So in the clinic, we use some orthopedic tests to diagnose this type of discogenic back pain, or at least to differentiate it from other types of back pain. And the primary tests, orthopedic tests that are used are the straight leg raise, the slump test, the Valsalva test, and Milgram's test. All of those can help us figure out if the disc is part of why there's pain in the back. As we talk about disc pain, it's important to recognize that there are lots of people who have a herniated disc or have damage to the disc that actually don't have any pain. So there's some poor correlation between the imaging finding a degenerated disc and actually having pain in the body, which is great for us as conservative healthcare practitioners or chiropractors, because really we're focused on function, improving the function of the body, and minimizing those pain signals that you're getting from the nervous system. And so even if you do have these imaging findings, there's still a lot that we can do to help. It's important to recognize that the body and the mind both play a part in pain. That pain is not only a physical phenomenon. So again, like what I just mentioned with the imaging findings, you can have somebody who does have a herniated disc who has no pain. You can also have somebody who has who doesn't have a herniated disc, but has a lot of stress in their life and has a lot of pain. So we want to keep that in mind as we do these different exercises. So the 4 exercises for discogenic back pain are the cat-cow, sciatic nerve flossing, the side bridge, and the dead bug. So how to do these exercises? It's the way that you want to do these exercises is with awareness. You want to be really present with what you're doing. You want to keep your breath full throughout the entire time. Even though we're focused on the low back, you want a full body engagement. So you don't want to over focus on one area, but you want to spread your focus out throughout the entire body. You want to push yourself and feel like you're efforting, but you don't want to push yourself so hard that you can't walk the next day. And you want to be careful, but you also want to go up to your edge of what's comfortable for you and start to recognize that you can do more than you think you can. So starting with the first exercise, this is the cat-cow. You're starting on all 4s, hands, your spine is neutral. And then as you inhale, you're going to go ahead and arch the spine. The head's going to come up. The chest is going to move forward slightly between the hands. And then as you exhale, you're going to round the spine, drawing the belly up towards the front of the spine, tucking the chin in. And you'll just go back and forth here. You can hold in one position or just going back and forth. So next is the supine sciatic nerve floss. This is primarily used for people who have pain down the leg, but it can be a useful exercise even if you don't have pain down the leg. So you're laying on your back. You bring your knee in towards the chest and you place your hands just behind the knee. The knee is bent. Then begin to straighten the leg gently up towards the sky. And you can gently tuck the toes towards the body. Of this where you lift the head off of the ground as you go, pointing the toe and lifting the head off the ground. That's a more advanced variation, and I would recommend working with a trained professional to learn that one. Next is a side bridge. So this is a gentler version of the side bridge because the knees are bent. You can also do this where you lift the knees up off the floor. So you're on your side on the forearm and the knees, and the hips are on the ground. Then you draw the hips up in line with the shoulders, so you're hovering the hips up off the ground, maintaining your balance. You can stay here or you can do reps. Lastly is the dead bug. So you're on your back, your arms are up with your hands above your chest, and your knees are above your hips with your feet off the floor in line with the knees. You can challenge yourself by extending the opposite arm and leg in opposite directions, straightening both, reaching towards opposite corners of the room, and bringing those back to neutral, and then switching sides with the arm and the leg. So those are the 4 exercises for discogenic back pain. The precise number of reps and sets that you do will really depend on where you're at. Oftentimes it's recommended to do 3 sets of 10. Really, you just want to do enough reps of each exercise that you feel like you're efforting, and but not so many that you're fatiguing yourself. And if you find these exercises are too easy for you at some point, you may have to change them or vary them in some way so that you are really getting the most out of them. Or if you feel like they're too challenging for you, you may have to create some modifications to make them easier for you. And that's what a trained professional can help you with this. So that's the benefit of working with me. I have a lot of experience in yoga. I have a lot of experience in other modalities to kind of help you find the hardest exercise that you can do well. So my approach is threefold. Reset the system, reinforce what we've done, and retrain the system. So this is the third step. It's the retraining step. The reset phase usually involves hands-on adjustments, massage, other types of modalities. The reinforcement phase involves that help, whether that's working with your posture, improving your sleep, managing your stress. And then this retraining phase where we're increasing strength in the system. So hope that you found these exercises really helpful and that you're able to do them. The best way is to create a customized or personalized plan for you, and that's something I'd be happy to do with you, making sure that you're getting the exercises that are going to keep you out of pain but also prevent future problems down the road. If you do decide to do these exercises they're not working for you within the first 7 days that you try them, then it's best to work with a trained professional to get exercises that may be more appropriate for what's going on with you. So thanks so much for watching, and I look forward to working with you in the future.